Good evening. This is All India Radio. I'm Manoj Singh Rana, and with me is R.S. Raghu with the evening news. The headlines: Government allows import of 17 critical medical devices to provide relief to COVID patients. Prime Minister Narendra Modi reviews preparedness of Army to deal with COVID-19 situation. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID-19 patients. Over 2 crore 12 lakh register in the CoWIN portal for vaccination so far. Portal works without glitches. Over 3,79,000 new COVID-19 cases reported. Over 2,69,000 people recovered in the last 24 hours. Bharat Biotech reduces price of Covaxin from 600 rupees to 400 rupees for the states. National Commission for Women launches WhatsApp helpline number for pregnant women. Uttarakhand government suspends Char Dham Yatra due to surge in COVID-19 cases. 40 countries come forward to provide medical assistance to India, says Ministry of External Affairs. Voting for the final phase in West Bengal concludes peacefully. 76.07% voter turnout reported till 6 p.m. And in IPL cricket, Mumbai Indians defeat Rajasthan Royals by 7 wickets in first match. Delhi Capitals elects to field against Kolkata Knight Riders in second encounter. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the person of age between 18 and 44 would begin from 1st May at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. Now, the news in detail. The government has expedited the process of import of critical medical devices amid the growing demands due to COVID-19 pandemic situation in the country. In this connection, the Union government has permitted importers to import 17 medical devices required to provide relief to the COVID patients. An order issued by the Department of Consumer Affairs yesterday will remain in force for 3 months. The permission has been granted for the import of nebulizers, oxygen concentrators, CPAP and BIPAP devices, vacuum pressure swing adsorption, oxygen tons, and cryogenic oxygen air separation unit. In addition to these, permission has also been granted for the import of oxygen canister, oxygen filling systems, and oxygen cylinders, including cryogenic cylinders and ventilators, among others. The department has directed that the importers shall inform about all such imports to the officials in the state where the equipment will be imported. Prime Minister Narendra Modi today reviewed the Army's preparedness and initiatives to deal with COVID-19 situation in the country. The Prime Minister and Chief of Army Staff, General M.M. Narvane, discussed various initiatives being taken by the Army to help in COVID management. General M.M. Narvane informed the Prime Minister that medical staff of the Army is being made available for various state governments. He added that the Army is setting up temporary hospitals in various parts of the country. Mr. Narvane apprised the Prime Minister that the Army is opening up its hospitals for civilians. He informed that the Army is helping with manpower for imported oxygen tankers and vehicles where specialized skills are required to manage them. Meanwhile, Prime Minister Narendra Modi will chair a cabinet meeting at 11 a.m. tomorrow over COVID-19 situation in the country.
Union Health Ministry has issued revised guidelines for home isolation of mild and asymptomatic COVID-19 cases. As per the guidelines, the patients who are clinically assigned to be mild or asymptomatic are recommended for home isolation. As per the guidelines for home isolation, the patient should be clinically assigned as mild or asymptomatic case by the treating medical officer, and such cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. More from our correspondent.
According to the revised guidelines, the Health Ministry has said the patient must isolate himself from other household members, stay in the identified room and away from other people in home, especially elderlies and those with comorbid conditions. The patient should be kept in a well-ventilated room with cross-ventilation. Patient should at all times use triple-layer medical mask. The patient has been advised self-monitoring of blood oxygen saturation and health and must be in communication with a treating physician and promptly report in case of any deterioration. The decision to administer remdesivir or any other investigational therapy must be taken by a medical professional and administered only in a hospital setting. As per the guidelines, patient under home isolation will stand discharged and end isolation after at least 10 days have passed from onset of symptoms or from date of sampling for asymptomatic cases and no fever for 3 days. The ministry said there is no need for testing after the home isolation period is over. With Anand Kumar, Suparna Saitya, IR News, Delhi.
Union Health Ministry has also come out with a protocol for management of COVID-19 in the pediatric age group. The ministry said children with COVID-19 infection may be asymptomatic, mildly symptomatic, moderately sick or with severe illness. As per the protocol, asymptomatic children are usually identified while screening if family members are identified. Such children do not require any treatment except monitoring for development of symptoms and subsequent treatment according to assessed severity. It said children with mild disease may have sore throat, rhinorrhea, cough with no breathing difficulty, and few others may have gastrointestinal symptoms also. It said such children do not need any investigation. As per the protocol, these children can be managed at home with home isolation and symptomatic treatment. There should be regular communication with a doctor or a healthcare worker.
Union Health Minister Dr. Harshvardhan today said that India has one of the lowest mortality rates in the world, but each and every death due to COVID is tragic and painful. He said the national mortality rate has been falling and currently stands at 1.11%. Briefing the media after visiting Lady Hardinge Medical College in New Delhi, he stressed on the need to work towards improving diagnosis and help as many people as possible using teleconsultations to provide right advice to the patients recovering at home. Appreciating the COVID vaccine registration portal, the minister said that seamless registrations are being done through the digitally and technologically sound portal. The portal witnessed more than 80 lakh people registering themselves within just 3 hours from 4 p.m. to 7 p.m.
Government has said that more than 2 crore 12 lakh people have registered for vaccination in the CoWIN portal since yesterday. Union Health Ministry said more than 75 lakh people have registered on CoWIN today. It has requested people to register themselves on www.cowin.gov.in if they are eligible and get vaccinated on their turn. The portal handled more than 50,000 application program interface API calls per second. The vaccination for people above 18 years and above will begin on Saturday. Government said CoWIN digital platform continues to work without any technical glitch. Health Ministry said in the first 3 hours from 4 p.m. to 7 p.m. yesterday, more than 80 lakh people registered themselves on the portal.
The Health and Family Welfare Ministry is informed that more than 1 crore 6 lakh doses of COVID vaccines are still available with the states and union territories. The union government has provided over 16 crore 16 lakh doses of vaccines to states and union territories free of cost so far. Of this, the total consumption of doses, including wastages, is over 15 crore 10 lakh. The ministry is assured that more than 20 lakh vaccine doses will be provided to states and union territories within the next 3 days.
Oxygen Express operations of Indian Railways continue to bring relief to the states as its operations expanded to Haryana and Telangana. Earlier, this Oxygen Express train had delivered liquid medical oxygen to Maharashtra, Uttar Pradesh, Madhya Pradesh and Delhi. Railway Ministry said, continuing the momentum, there are 3 more trains on the run, either carrying liquid oxygen or on the way to loading plants. It is expected that cumulative liquid medical oxygen carried by Indian Railways will reach almost 640 tons in next 24 hours. Uttar Pradesh received its Oxygen Express number 5 carrying over 76 tons of liquid medical oxygen today in 5 tankers. Haryana will receive its first Oxygen Express as a train with 2 tankers is expected to leave Angul, Orissa today. The ministry said Telangana government has also requested Indian Railways for Oxygen Express. An empty rake is on its way from Sikandrabad to Angul with 5 empty tankers and is expected to reach Angul tomorrow.
The Indian Institute of Technology, IIT Bombay, has come up with a creative and ingenious solution to addressing the shortage of medical oxygen for treatment of COVID-19 patients in the country. The pilot project, which has been tested successfully, relies on a simple technological hack, that is, conversion of pressure swing adsorption PSA nitrogen unit to PSA oxygen unit. The Education Ministry said initial tests done at the IIT Bombay have shown promising results. Oxygen production could be achieved at 3.5 atm pressure with a purity level of 93 to 96%. The Ayush Ministry has said that scientists have found that Ayush 64 is useful in the treatment of asymptomatic, mild and moderate COVID-19 infection as an adjunct to standard care. Ayush 64 is a polyherbal formulation developed by the Central Council for Research in Ayurvedic Sciences. Initially, the drug was developed for malaria in the year 1980 and now is repurposed for COVID-19. The Ayush Ministry and the Council of Scientific and Industrial Research in collaboration have completed a robust multi-center clinical trial to evaluate its safety and efficacy. The centre has said that the national directives for COVID-19 management will continue to be strictly followed throughout the country till 31st May this year. The Ministry of Home Affairs has directed all states and union territories to consider the containment measure for immediate implementation based on the assessment of the situation. It has asked them to implement the necessary containment measures under the relevant provisions of the Disaster Management Act.
Labour Ministry has said Employee State Insurance Corporation has reached out to its beneficiaries to provide medical care and relief during COVID-19 pandemic. The insured persons or their family members in case of being infected with COVID-19 can avail free of cost medical care in any of the ESIS hospitals which have been declared as COVID-19 dedicated hospital. Presently, 21 ESIC hospitals run directly by ESIC with 3,676 COVID isolation beds, 229 ICU beds and 163 ventilator beds are functioning as COVID-dedicated hospitals. More than 15 crore vaccine doses have been administered so far in the country. Yesterday, more than 21 lakh vaccine doses were administered. In the last 24 hours, over 2,69,000 people were discharged. Health Ministry said in the last 24 hours, more than 3,79,000 new COVID-19 cases were reported. With this, total cases have reached more than 1 crore 83 lakh. Till now, over 1.5 crore people have recovered from infection. The recovery rate stands at 82.10%. The ministry said 3,645 deaths were reported in the last 24 hours and the death toll in the pandemic has crossed 2,04,000. Active cases in India are now at over 30 lakhs.
Bharat Biotech today reduced the cost of Covaxin vaccine for state governments. It will now cost 400 rupees per dose for state governments instead of earlier announced price of 600 rupees per dose. Bharat Biotech has said the decision has been taken recognizing enormous challenges being faced by the public healthcare system. Covaxin will cost 1,200 rupees per dose for private hospitals. The price of vaccine for export is $15 to $20. Earlier, the price of Covishield vaccine for states was also reduced from 400 to 300 rupees.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Government allows import of 17 critical medical devices to provide relief to COVID patients. Prime Minister Narendra Modi reviews preparedness of Army to deal with COVID-19 situation. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID-19 patients. Over 2 crore 12 lakh register in the CoWIN portal for vaccination so far. Portal works without glitches. Over 3,79,000 new COVID-19 cases reported. Over 2,69,000 people recovered in the last 24 hours. Bharat Biotech reduces price of Covaxin from 600 rupees to 400 rupees for the states. National Commission for Women launches WhatsApp helpline number for pregnant women. Uttarakhand government suspends Char Dham Yatra due to surge in COVID-19 cases. 40 countries come forward to provide medical assistance to India, says Ministry of External Affairs. Voting for the final phase in West Bengal concludes peacefully. 76.07% voter turnout reported till 6 p.m. And in IPL cricket, Mumbai Indians defeat Rajasthan Royals by 7 wickets in first match. Delhi Capitals elects to field against Kolkata Knight Riders in second encounter. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Welcome back to the evening news. National Commission for Women has launched a WhatsApp helpline number for providing emergency medical assistance to pregnant women. The number is 9354954224. The move came after the NCW noticed that pregnant women were facing difficulty in accessing medical aid. Expectant mothers from across the country can reach out to the Commission through this number, which will be functional round the clock. A dedicated team is looking after speedy redressal of grievances. The Commission can also be reached on the email ID help@ncw@gmail.com. Amid surge in COVID-19 cases, 11 districts of Jammu and Kashmir will observe lockdown from 7 p.m. this evening till 7 a.m. on Monday. These districts include Srinagar, Anantnag, Baramulla, Budgam, Kulgam, Pulwama, Gandarbal, Jammu, Kathua, Riyasi and Udhampur. Essential services have been exempted from the lockdown. Pertinently, Jammu and Kashmir reported 3,023 new COVID-19 cases, 963 recoveries and 30 deaths in the last 24 hours. The total cases have piled up to 1,69,077.
In the wake of sharp surge in number of COVID-19 cases, the Himachal State Government has decided to impose complete restrictions on community feast, Dham, during the marriages and other celebrations in the state. This was decided in a high-level meeting held under the chairmanship of Chief Minister Jairam Thakur to review the COVID-19 situation of the state in Shimla today. Chief Minister said, sharp rise in COVID-19 cases is a matter of concern and state government is making every effort to contain the spread of pandemic by taking few stringent steps. He said, government had also decided to restrict social gatherings during marriages, etc. up to 20 persons. He stated that all the educational institutions as well as temples of the state would remain closed until 10th of next month. The Delhi High Court has asked Centre to file a status report on the supply of oxygen to Delhi and asked why Delhi is out of line with other states when it comes to supply of oxygen. The court was hearing petitions on various issues including oxygen supply in the wake of rise in COVID-19 cases in the national capital. Senior advocate Rahul Mehra, appearing for Delhi government, apprised the High Court about other states which are getting within a range of 2 to 3% of what they projected. Amicus Raj Shekhar Rao informed the court that Madhya Pradesh and Maharashtra received more quantity of oxygen than they asked for.
In Uttarakhand, Chief Minister Tirath Singh Rawat has said that the Char Dham Yatra is cancelled due to surge in COVID cases. Talking to the media in Dehradun today, he informed that the web portals of the 4 shrines will be opened as per the schedule. Tirth Purohit and the priest of the shrines will perform rituals as earlier, but devotees will not be allowed to perform puja archana at shrines. Portals of Gangotri, Yamunotri, Kedarnath and Badrinath will open next month. The Uttar Pradesh government has decided to extend the Corona curfew for one more day on weekend in the state. The curfew in state will continue on Monday, also apart from Saturday and Sunday. It will now start from 8 p.m. in the evening on Friday and will end at 7 a.m. in the morning on Tuesday. In another important development, the doctors practicing Ayurveda will also help in fighting against coronavirus in the state. The number of such doctors in a state around 5,000. On the other hand, Chief Minister Yogi Adityanath has directed officials to increase around 33,000 COVID beds in state. These beds will be of L1, L2 and L3 categories.
In Bihar, night curfew began at 6 p.m. today in view of increasing number of COVID cases in the state. The curfew will be till 6 a.m. tomorrow. Shops and business establishments were closed by 4 p.m. Essential services have been exempted from this order. These decisions were taken by the Crisis Management Group headed by Chief Minister Nitish Kumar. 50 persons will be allowed for marriage ceremony while only 20 persons will be permitted for funeral procession. The government and private offices were closed after 4 in the afternoon. 25% attendance was allowed in offices. The state government will bear all expenses of funeral of those who died due to COVID and related diseases. In Tamil Nadu, night curfew and complete lockdowns on Sundays until further orders has been extended until further orders. The Chief Secretary Rajiv Ranjan had a meeting with top officials and district collectors to assess the COVID situation in the state.
On counting day, May 2nd, movement of transport of election-related officials, candidates, booth agents, food suppliers in connection with counting of votes will be allowed. During the night curfew, which begins from 10 p.m. to 4 in the morning, no transport, both private and public, will be permitted. The Chennai Corporation Commissioner G. Prakash has said that there was no abnormal increase in deaths. Speaking to news persons in Chennai today, he said that more vaccination centers were being added to ensure that people get their second dose of vaccination without much hassle. He told that the corporation had held meetings with the transport department and 400 new buses would be added to the existing fleet to avoid overcrowding in buses. Joy, AIR News, Chennai.
Kerala continues to report high surge in COVID cases as it confirms 38,607 new cases today. State is to impose strict restrictions in the next week. A report.
Chief Minister Pinarayi Vijayan, while addressing the media today, said that more strict control measures will be imposed from coming Tuesday to Sunday in the state as the COVID scenario worsens. Oxygen war rooms would be set up in various districts to ensure the availability of oxygen in case of emergencies. The shootings of cinemas, TV serials and programs suspended in the state till further notice. Chief Minister urged the people to voluntarily follow a self-lockdown. Meanwhile, the test positivity rate in Kerala is at alarming 24.5%. 48 deaths were also confirmed due to COVID today. Presently, over 284,000 active COVID cases are there in Kerala. Mayusha, AIR News, Thiruvananthapuram.
To prevent and combat the surge of COVID-19 in the state, the Nagaland government has issued fresh consolidated guidelines to be implemented throughout the state with effect from tomorrow till 13th of May. The consolidated guidelines stated that summer break for all schools and colleges have been declared with effect from the date of issue of this order until further notice. All coaching, vocational institutions, student hostels will remain closed. However, online or distance learning will continue to be permitted and encouraged. On Thursday, Sikkim recorded its biggest ever single-day spike in COVID-19 cases with 170 new cases reported in the last 24 hours. This comes a day after the state had reported a record 151 cases. Sikkim has now recorded 710 cases since 24th April with 1,512 cases this month. The Union Ministry of Health and Family Welfare provided 150 AGVA ICU ventilators to Manipur for use in tackling COVID-19 pandemic, and these medical equipment have arrived in Imphal today. The Chief Minister, Shri Biren, said that the central government had also provided 400 oxygen concentrators and 500 D-type oxygen cylinders, and Manipur now has around 3,000 D-type cylinders.
The Ministry of External Affairs has said that 40 countries have come forward to provide assistance to India to fulfill the requirements of several medical equipments and medicines in the country. Briefing the media in New Delhi today, Foreign Secretary Harshvardhan Shringla said consignments carrying medical equipments and medicines have started to arrive in India from various countries.
We have received offers of assistance from various governments. There has been quite an outpouring of, I would say, solidarity with India. There has been, let's say, assistance from various countries. Over 40 countries committed to provide us with many of the items that we need most urgently.
Meanwhile, a special cargo for medical aid of 157 ventilators, 480 BIPAPs and other medical supplies arrived from UAE to India today. External Affairs Ministry sources said IAF C-17 has so far airlifted 18 cryogenic oxygen containers from Dubai airport and landed at Panagarh Air Base in 3 sorties since April 26.
The high-stake battle for Bengal concluded today after a prolonged 8-phase election. The electoral battle was waged for 294 assembly seats by over 2,000 candidates. the AITC and the BJP for the election alone on all the seats. As the voting process concludes today, West Bengal now waits for May 2nd when the counting of votes will be held. More from our Kolkata correspondent.
In the last phase of West Bengal Assembly election today, polling concluded peacefully across 11,860 polling stations across 35 assembly constituencies. The voter turnout of 76.07% was reported by 6 p.m. Now everyone's attention is towards the counting day. The Election Commission has banned victory celebrations on the counting day to avoid spread of the pandemic. The political agents are asked to follow COVID protocol while present in the counting centers. No candidate or agents of the political parties will be allowed inside the counting hall without undergoing the RT-PCR test. Only those with negative COVID test will be allowed into the counting centers. It can be mentioned here that West Bengal has reported one of the highest COVID positivity rate in the country. Sudhindra, AIR News, Kolkata.
Most of the exit polls have predicted victory of the Trinamool Congress in West Bengal Assembly elections, while some predict a close contest between the BJP and the TMC. The exit polls telecast by different private TV channels this evening gave the TMC 128 to 176 seats and the BJP 109 to 148 seats. In Assam, exit polls are predicting BJP's victory. The BJP is expected to win 58 to 85 seats and the Congress 40 to 66 seats. However, some exit polls are also showing a close contest between the BJP and the Congress in the state. Maximum exit polls are showing the LDF taking a lead in Kerala and the DMK Congress alliance ahead in Tamil Nadu.
Voting for the fourth and final phase of Panchayat elections concluded peacefully in 17 districts of Uttar Pradesh. No untoward incident was reported from any place during the voting, barring a few sporadic incidents at some places. Uttar Pradesh Panchayat elections were held in 4 phases, while the counting of votes will take place on May the 2nd. In first of the 2 IPL matches today, Mumbai Indians beat Rajasthan Royals by 7 wickets. Mumbai successfully chased the target of 172 runs with 9 balls to spare. In the second match in Ahmedabad, Kolkata Knight Riders were batting at 116 for 6 in 17.1 overs against Delhi Capitals when reports last came in. DC captain Rishabh Pant won the toss and chose to field. Kolkata has kept its team unchanged, while Delhi has brought Lalit Yadav in place of injured Amit Mishra. Victory for the Capitals will lift them to 10 points at par with the table toppers Chennai Super Kings and the Royal Challengers Bangalore. Net run rate will keep them at 3rd spot though.
Now let us take a look at the weather forecast. Jammu will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. Minimum temperature will be around 23 and the maximum 40 degrees Celsius. Srinagar will have a generally cloudy sky with light rain. Leh will have a mainly clear sky with temperatures ranging between 3 and 17 degrees Celsius. Gilgit will have a mainly clear sky. Muzaffarabad will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. Chandigarh will have a generally cloudy sky. Minimum temperature will be around 24 and maximum 42 degrees. Dehradun will have a partly cloudy sky with possibility of development of thunder lightning. Temperature will move from minimum of 20 to maximum of 38 degrees Celsius. National capital Delhi will have a partly cloudy sky. Minimum temperature is expected at 23 and the maximum could go up to 40 degrees. Mumbai will have a partly cloudy sky. Minimum temperature will be around 26 and maximum 34 degrees Celsius. Chennai is going to have a partly cloudy sky. Minimum temperature will be around 29 and the maximum may go up to 38 degrees Celsius. And now, before we end the bulletin, headlines once again. Government allows import of 17 critical medical devices to provide relief to COVID patients. Prime Minister Narendra Modi reviews preparedness of army to deal with COVID-19 situation. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID-19 patients. Over 2 crore 12 lakh register in the CoWIN portal for vaccination so far. Portal works without glitches. Over 3,79,000 new COVID-19 cases reported. Over 2,69,000 people recovered in the last 24 hours. Bharat Biotech reduces price of Covaxin from 600 rupees to 400 rupees for the states. National Commission for Women launches WhatsApp helpline number for pregnant women. Uttarakhand government suspends Char Dham Yatra due to surge in COVID-19 cases. 40 countries come forward to provide medical assistance to India, says Ministry of External Affairs. Voting for the final phase in West Bengal concludes peacefully. 76.07% voter turnout reported till 6 p.m. And in IPL cricket, Mumbai Indians defeat Rajasthan Royals by 6 wickets in first match. Delhi Capitals elects to field against Kolkata Knight Riders in second encounter. And with that, we end the evening news. Good night.